Have you ever wondered how a UTI antibiotic could leave a woman unable to walk? In our journey through life, we often cross paths with antibiotics. These tiny molecules, invisible to the naked eye, wage war against harmful bacteria in our bodies, aiding us in the fight against infections. They're our silent allies, our unseen protectors. But as they say, every rose has its thorns. Let's take a moment to talk about a woman just like any other. She woke up one day with an uncomfortable sensation, a telltale sign of a urinary tract infection or UTI, a common ailment and nothing to be overly concerned about. So she did what most of us would do. She went to her doctor, received a prescription for antibiotics and began her treatment. But then something unexpected happened. This woman, who had been leading a normal life, suddenly found herself unable to walk. She was crippled not by the infection she was fighting, but by the very medication that was supposed to help her overcome it. It's a chilling thought, isn't it? The unseen threat wasn't the infection, but the side effects of the antibiotics. Now, don't get me wrong, antibiotics are crucial in modern medicine. They save countless lives every day, but like all medications, they come with potential side effects, and that's the key word here. Potential. Not everyone will experience these side effects, but for those who do, the effects can be, well, crippling. The irony is stark. A medication meant to restore health instead compromised it in a most unexpected way. It's a stark reminder of the significance of understanding not just the healing powers of our medications, but also their potential side effects. So what really happened to this woman, and could it happen to you? Let's delve deeper into this mystery in our next segment. To understand this, we first need to understand how antibiotics work. Let's imagine our body as a battlefield and the bacteria as the enemy soldiers. Antibiotics are the weapons we use to fight these invaders. They are designed to either kill the bacteria or stop them from multiplying, effectively helping our immune system to win the fight. Some antibiotics are like snipers, targeting specific types of bacteria, while others are more like bombs, killing a wide range of them. However, as with any weapon, antibiotics are not without their drawbacks. They can sometimes affect the body's normal functions. For instance, they can disrupt the balance of good and bad bacteria in our body, especially in our gut. This can lead to side effects such as nausea, diarrhea, or even more serious conditions like Clostridium difficile infection. There are different types of antibiotics, and each comes with its own set of potential side effects. Penicillins, for instance, can cause allergic reactions in some people, while fluoroquinolones, a powerful type of antibiotic, can cause nerve damage and even mental health problems in rare cases. But let's not forget, antibiotics are crucial in fighting bacterial infections. Without them, conditions like pneumonia or urinary tract infections could be deadly. However, they are not a one-size-fits-all solution and should be used judiciously. Overuse or misuse of antibiotics can lead to antibiotic resistance, a serious global health threat where bacteria become immune to the weapons we use to kill them. It's also important to note that antibiotics are ineffective against viruses, so using them to treat viral infections like the common cold or flu is like bringing a sword to a gunfight. Now that we've grasped how antibiotics work, let's delve into the specific case of our unfortunate woman. So what happened to the woman who couldn't walk after taking UTI antibiotics? Well, let's delve into the specifics of the case. This woman, let's call her Jane for the purpose of our discussion, had been experiencing the typical symptoms of a urinary tract infection: discomfort, a frequent urge to urinate, and a burning sensation when doing so. To address her condition, Jane was prescribed a common antibiotic for UTIs. On the surface, it seemed like a straightforward treatment plan. However, within a few days of starting the antibiotic, Jane began to notice something alarming. Her legs were becoming increasingly weak and she was struggling to walk. This was understandably a cause for serious concern. Jane sought immediate medical help and was diagnosed with a condition known as antibiotic-induced neuropathy. This condition, while rare, is a serious side effect of certain antibiotics, where the medication interferes with the normal functioning of the nerves in the body. In Jane's case, the antibiotic she took for her UTI had a profound effect on the nerves in her legs, leading to weakness and ultimately the inability to walk. This was not an outcome anyone would anticipate from a course of antibiotics, particularly when prescribed for a relatively common condition like a UTI. It's important to note that Jane's experience, while alarming, is not the norm. Most people taking antibiotics for a UTI will not experience such severe side effects. However, her case does highlight the potential risks associated with these medications and underscores the importance of discussing potential side effects with your healthcare provider. This brings us to the crucial question: why did this happen? How did a UTI antibiotic lead to such a severe reaction? To understand this, let's take a closer look at the situation. Antibiotics are powerful tools in medicine's arsenal, designed to kill bacteria and treat infections. However, like any medication, they can have side effects. In this case, the woman's inability to walk was likely a result of a rare neurological side effect from the antibiotic used to treat her urinary tract infection. The antibiotic may have caused a condition called peripheral neuropathy. This is a disorder that results from damage to the peripheral nerves, the nerves that carry signals between the central nervous system, that's your brain and spinal cord, and the rest of your body. Symptoms can range from numbness, tingling, and pain to more severe complications like muscle weakness or difficulty walking. In this particular case, the antibiotic may have caused inflammation or damage to the nerves controlling the muscles in her legs. This damage could have disrupted the normal signal from her brain to her leg muscles, leading to muscle weakness and the inability to walk. It's important to note that such a reaction is extremely rare, but it does highlight the potential power and unpredictability of antibiotics. Furthermore, some antibiotics can also have a direct impact on muscle health. Certain types can impair the way muscles function and repair themselves, leading to weakness and even muscle breakdown. Again, these are rare occurrences, but are potential risks nonetheless. Now you might be wondering, but is this a common occurrence? Should we all be worried? The truth is, while this reaction is severe, it's also extremely rare. Most people who take antibiotics for UTIs or other infections experience minor side effects, if any. However, it's a stark reminder of the importance of using antibiotics responsibly and under the guidance of a healthcare professional. It's always crucial to weigh the benefits and potential risks of any medication. After all, knowledge is your best defense. How common is this scenario, and what can we do to prevent it? You might be wondering, and rightly so, instances where antibiotics meant to heal end up causing distressing side effects such as the inability to walk are unfortunately not as rare as we'd like them to be. Antibiotics, while being life-saving, can sometimes prove to be a double-edged sword. The Centers for Disease Control and Prevention estimates that around 1 out of every 5 emergency department visits for adverse drug events are due to antibiotic use. This highlights the importance of understanding the potential side effects that come with these medications. The risk of adverse reactions can be influenced by various factors. These include the type and dosage of the antibiotic, the duration of treatment, and the individual's overall health status. Certain antibiotics are known to have a higher risk of causing severe side effects, and some individuals may be more susceptible due to pre-existing conditions or genetic factors. So, what can we do to prevent such distressing scenarios? The key lies in being informed and proactive. Understanding the potential side effects of the drugs we take is crucial. Always consult with healthcare professionals before starting any medication, and don't hesitate to ask questions. Ensure you fully understand the potential risks and benefits, and be vigilant about any unusual symptoms that may arise during treatment. Additionally, practicing safe medication use is vital. Always follow the prescribed dosage and schedule, and never self-medicate, especially with antibiotics. Remember, antibiotics are not a cure-all. An unnecessary usage can lead to antibiotic resistance, a global health concern. Lastly, maintaining a healthy lifestyle can help strengthen your body's natural defenses and reduce the risk of infections that may require antibiotics in that first place. Regular exercise, a balanced diet, adequate sleep, and stress management are all parts of a holistic approach to health. Remember, being informed is the first step towards a healthier life. Let's strive to make informed decisions about our health, not just for ourselves, but for the larger community as well. Because at the end of the day, our health is our wealth, and preserving it is our collective responsibility.